All right, now we're covering part 2 of joints, so share screen. Okay, so synovial joints can be classified by shape as well, okay, as well as the movement. They're also classified by shape, okay. Plane joints are flat planes, the two surfaces are flat, and therefore the only movement is gliding, okay, and the movements are non-axial, okay? So they don't rotate in any way, so non-axial, okay? So plane versus plane, okay? The examples, intercarpal joints, right? In between the carpals, okay? Intertarsal joints, in between the ankle bones, and then joints in between the vertebrae, okay? The vertebral articular surfaces. So between the superior articular facet of one rib or superior articular facet of one vertebrae and the inferior articular facet of another vertebrae, okay? All right, hinge joints, okay? Hinge joints look like that. So this is a hinge, okay? You realize that it's the same type of hinge as a door, right? So a door is a hinge joint. Doors and hinges only rotate in one direction, the direction in which it swings, okay? So angular movement is allowed in one plane. One is so uniaxial, okay? One rotating plane, okay? So you'll see it in your elbow, your ankle, and the joints between phalanges, okay? So this joint right here, okay, this is all I can do. This joint right here, this is all I can do, okay? Another hinge joint, okay, is your jaw, okay? Open, close, this is all you can do, okay? Your jaw is usually referred to as a modified hinge joint because you can rotate it a little bit, okay, but modified hinge joint. So it's still a hinge joint, okay? All right. Pivoting is a turn, it's a rotation around this long axis. So proximal radial ulnar joint, so proximal radial ulnar joint, this joint right here, when I want to rotate, okay? I can't actually rotate my wrist, okay? When I do this, I'm not actually rotating my wrist, I'm rotating my entire forearm. You see that? What I'm actually doing is rotating my proximal radial ulnar joint. Okay? Okay, the other example, atlantoaxial joint. Atlanto, atlas, okay? And then axial, axis. This is how I shake my head. No, I'm rotating C1 around C2. Okay? Okay. Okay. Condylar or ellipsoid joints. Okay, some books break it down into more elliptical, therefore ellipsoid or condylar, less elliptical. Okay, I don't care. They're all called condylar joints. Okay, condylar joints allow for two directions. Okay, so two is bi, so biaxial. Okay, abduction, adduction, so abduction, adduction. Okay, and flexion, extension. Okay, so abduction, adduction, flexion, extension. So two axes. Okay, so this is commonly known as your knuckle joint. Okay, I will not accept knuckle joints on the test. I want you to call them by what they're actually scientifically called. Okay, the metacarpal phalangeal joints. Okay, so metacarpal. So this is the metacarpal. This is the phalange. So metacarpal phalangeal joints. Okay. The other joint is this is your wrist joint. Your wrist joint, I can flex, I can extend, I can abduct, abduct. Okay. My wrist cannot rotate. I'm rotating my forearm, not my wrist. Okay. All right. So the wrist joint is actually called the radial carpal joint. Radius and carpal. Okay, remember your ulnar doesn't play much of a role, so radial carpal joint. Okay, saddle joints are much deeper biaxial joints, so two axes. So I can flex, I can extend, I can abduct, I can abduct. Okay, I can flex a lot more than I can abduct, abduct, which is why it's called a saddle joint because it looks like a saddle. Sorry. It looks like a saddle. Okay, there's only one good location in here, and that is the carpal metacarpal joint of the thumb. It is not this joint. It is this joint. Okay, this is your saddle joint. This is what allows for opposition. Okay, carpal wrist bone right here. So carpal metacarpal joint of the thumb. So this is metacarpal 1. This is actually the trapezium. Okay, so it's actually called the trapezium metacarpal joint. Okay, metacarpal 1 joint or metacarpal joint. Okay, this is the saddle joint. Okay. The synovial joints, okay, are multi-axial. So I can do it. Sorry, the ball and socket joints are multi-axial. Okay, ball socket. Okay, I can flex, I can extend, I can abduct, I can adduct, and I can rotate. Okay, so the head of the shoulder, okay, into the scapula, okay, that is the glenohumeral joint. Okay, so I want you to use the scientific name for it, glenohumeral joint. Glenoid cavity, head of the humerus, glenohumeral joint. The hip joint is called the femoral acetabular joint. Femoral acetabular joint. Okay. 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 The factors that influence synovial joints, stability in synovial joints. The articular surfaces allow for which way they can move, but they don't play much of a role in stability. They don't hold the joint there. The exception being the hip joint and the elbow joint. These are actually locked in pretty tightly. Okay. The ligaments. Okay. The ligaments are actually what keeps the joint in place. Okay. All right. So the more ligaments, the stronger and stable the joint. So one of the big difference between your shoulder and your hip is not only how shallow that is, but how there's no ligaments really that directly connected to. They kind of wrap around and hold the thing together, but there's nothing that directly connected to. The hip joint, there is a big ligament that attaches the femur to the acetabulum. Called the ligamentum teres. It literally holds the thing in, so it's much stronger. Okay. But the way we actually stabilize joints is muscle tone. Okay, we actually have muscles that cross the joint. Okay, And so if you ever dislocate your shoulder, one of the things they send you to PT to do is actually rebuild muscle. Okay, so you rebuild the muscle, you hold the joint in tighter. Okay, all right. So we're not going to get into the selected synovial joints. I'm just going to show you a couple of cool little features. Okay, tabular joint. Okay, the shoulder. Remember, the shoulder. The correct name for shoulder is glenohumeral joint. Okay. Okay, so there's the shoulder. Okay, you can see on a real skeleton how shallow this is and how easy it is to dislocate this bone. And you know, you can see that in people. I'm sure some of you guys have seen a dislocated shoulder before, and if you haven't, you can Google. In fact, there was one famous incident either last year or the year before. Kevin Love separated his shoulder while playing basketball in the middle of a game, and he just popped out his shoulder. And you can see how easy that is. Okay. 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 So I'm gonna start muscles right here. The rotator cuff, the muscles that protect your shoulder are called a rotator cuff. Okay, and here are the four of them. Okay, so we'll make sure I'll make sure to point out all these muscles next week. Okay. Okay. Elbow joint, forward. Okay. What we commonly call the wrist joint is really the radial carpal joint. Okay. The intercarpals, they don't do very much. So the wrist joint is primarily the radial carpal joint. Okay. Okay. So you see that right here. Radial carpal joint. Okay. The hip joint. Okay. The hip joint is a ball and socket joint, so you can see how deep that is and how stable that is. Okay. The hip literally curves around the femur to hold it in place. Okay. Okay. Sorry. The name for the hip. Okay. I just don't mention it here. Okay. It's called a femoral acetabular joint. Okay. Femur acetabulum, femoral acetabular joint. Okay. Okay. The knee joint. Okay. So here's the meniscus of the knee that I also explained earlier. Okay. This helps keep the knee in place. Okay. The knee joint is the largest and most complex joint. Okay. It acts like the hinge joint, but it's not. Okay. It's structurally considered a compound joint because there's actually three bones there. There is the femur, there is the tibia, and there's the patella. Okay. And so it's considered compound and bicondylar joint. Okay. The knee joint is none of the answers to the test about joints. Okay. Okay. So, okay. We also have, so the knee is also an example of ligaments that cross inside the joint. And this right here is the ACL. Okay. So you hear about basketball players and others, especially basketball players, but other sports tearing their ACL. Okay. And that's the ACL right there. Okay. So funny story is, okay, my knee swelled up once due to gout. I didn't know I had gout at the time, so it swelled out pretty badly. And so I went to the doctor's office and he got CT scan. Okay. And one of my friends is a radiologist, and so I was like, you know what? His name's also Peter. So I said, you know, Peter, take a look, you know, at my scan and tell me what you see and see if it checks out, see if the diagnosis checks out. And he looked at it and like calls me back that day. He's like, dude, when the hell did you blow out your knee? I'm like, I've never blown out my knee. You've known me my whole life. Don't you think you would have known? Like, you're missing an ACL. Like, crap. So, and then, you know, he was like, you're missing an ACL in the right knee. So I tested it out. And I really am missing that ACL because my right knee is a lot less stable than my left knee, even though my right leg is a stronger leg. And so what we kind of put together is that somewhere in the time I kind of slowly frayed my ACL and it broke. But there's actually no nerves on it. There's no pain sensation on the ACL. So I didn't know when I snapped it. Okay, but anyway, or it finally frayed to complete breakdown. But I have no ACL on my right leg. Okay, so that ends my basketball career. So, you know, even though I'm short and fat and all these other stuff and can't shoot or shit, the ACL is what kept me from, you know, playing for the Lakers. That's my story. All right. So, ankle joint. Okay, so let's talk about the disorders of joints. That's more important. Okay, and there will be a couple questions on disorders of joints on the test. Okay, all right. So torn cartilage, common injury to the meniscus of the knee. Okay, a sprain is by definition when the ligament is either stretched too far or torn. Okay, dislocation is when bones of a joint are forced out of the cavity. Okay. Bursitis, tendinitis, inflammation of the bursa or tendon sheath. Okay. Arthritis. Arthritis, there's three main types of arthritis: gout, osteoarthritis, and rheumatoid arthritis. Osteoarthritis is wear and tear injuries, okay, build up over time. Usually they occur in the big weight-bearing joints of the body. Your knee, for example, your hip, okay? Okay, sometimes the shoulder, but weight-bearing joints, okay? And they wear out, okay? Rheumatoid arthritis is an inflammatory disease, an autoimmune disorder that attacks the joints. And what they actually attack are usually the smaller joints. The rheumatoid arthritis, if you have seen a picture of rheumatoid arthritis, they usually show you fingers, okay, where the fingers are all literally bent out of whack. Okay, they're no longer straight and they're just all bent weird shapes and stuff. Okay, that's when, and rheumatoid arthritis tends to attack the smaller joints, okay, in the body. Gout is uric acid buildup, okay? So remember I told you joints have a lot of nerves, and then so a lot of nerves, that means they detect a lot of pain, okay? When you have uric acid in your body, okay, large amounts of uric acid in your body, that can crystallize out in the joints, okay? So, like I said, when I had gout, they actually drained my knee, and they said they could see the little crystals of uric acid when they drained it. I actually asked for it so I could show class, but they said no. Which I'm still upset about, but they had to dispose of it as medical waste, even though it's my fluid. All right, but it's all right. Anyway, that ends this presentation. I'll see you for chapter 10, which is talking about muscles. And recording.